The G8 leaders have been slammed for not providing enough help to HIV-positive people. The criticism has come during the ongoing AIDS conference in Vienna, which is calling for an end to so-called treatment discrimination. Well, for more on the meeting, our correspondent Sarah First joins us from the Austrian capital. Sarah, it's all very well, isn't it, having a scientific meeting of minds such as this, but is anything actually expected to come out of it?
Well, that's what everyone's here for, to come up with a plan moving forward to actually see some results. Now, we've seen already that funding's been a big topic over the last couple of days, and there's certainly been concerns that some countries, such as the US, are seen as perhaps weakening their commitment to funding. And now we've heard arguments such as that HIV and AIDS is overfunded. These have been called false arguments. It's said that there's really much more that needs to be done. There's still many people not receiving what people here are saying are life-saving treatments, and this is another really big issue here, is this access, universal access to HIV prevention treatments. Now, we've heard today former US President Bill Clinton speaking, and he's called for the HIV and AIDS organisations to really ensure that they're efficient in the delivery of their services, rather than complaining perhaps about the fact that there's not enough funding, to ensure that money's not being wasted anywhere, especially in light of the economic situation. But many of the speakers here have been very powerful in their message, and that's that everyone has a right to this treatment, and that healthcare shouldn't be an option that's dependent on a price tag. And certainly that's what forms the basis of this conference this week, is this issue of human rights.
Sarah, let's focus now on the human side of all this and the people involved who actually suffer from HIV. How are they caught up or involved in all this?
Well, we've seen a couple of the protests that have happened here as the conference has been ongoing. And as we said, the theme of this conference is rights here, right now. So it's really focusing on this on an individual level. And actually, the organisers have said that the prerequisite of human rights, that fundamental human rights issues are addressed, it is going to be the basis of what actually forms a successful response overall to the problem of HIV and AIDS. So we've seen a lot of people trying to get their voices heard and talking about the reality of living with the condition and what still needs to be done. And of course, in the days prior to the official conference, we heard from the other side, which was a group that were perhaps challenging the official definitions of HIV and AIDS, and also the standard treatments, the standard drugs treatments. Those were called into question. They were saying that there are alternatives out there. There are people who've tried these alternative methods, and that's maybe something that should be discussed. So we've seen a bit of a conflict there between the mainstream views on the way to approach the situation and the alternative groups who've had their own opinion on that too. I'm just going to give you some figures now that have come out of this conference. There's still, we've heard 33.4 million people living with AIDS. Those 2.7 million new infections every year, 2 million deaths a year, and 10 million people that are still waiting to receive treatment. So as we've said, this idea of human rights and this idea of these statistics, actually what we've been told is that every single one of these statistics, every fact that we hear over the coming week, these all represent an individual that is living with HIV, and it's their reality. So this issue of universal access is still very much on everyone's minds. That's what everyone's here to hopefully deliver. We can hear now